As I look around the room, it's very clear there are lots of different perspectives and different approaches towards addressing the challenges of NCDs in Kenya, and that's what we're hoping to harness.
Every health worker should be aware of these NCDs. Let us who are living with those conditions manage those facility area with the help of the in charge of the facility.
People live with the NCDs at locational level act as the leaders for setting up registries at locational level so that you know how many people have diabetes in a particular location or have hypertension in a particular location and their medicine needs.
Where there is ignorance and lack of information, that gap is filled by a lot of myths and misconceptions. There can never be a gap. Nature abhors vacuum. So that vacuum of unawareness is filled by the wrong information.
We are trying to reach out to even the national government, the stakeholders, to assist us then from the screening. How do we get them get treated, cheaper medicines, and get through the navigation process for treatment?
We have to deal with every aspect of the need. It's just not providing a medicine in a package.
Right.
It's about being part of the whole structure to deliver what is required for people.
Not just medicines that we need to look into, we need to look at the whole system. And I think the best way to look at that actually is to look at the patient journey.
How do we coordinate and organize what we call continuum of care?
Is the medicine there? Who's going to prescribe it? Who's diagnosing the patient? How do you know what the patient needs? So I think a big part of it is just not the medicine. We've got to solve for the holistic healthcare system in order to make sure that patients are getting what they need.
Looking at capacity building, education and training, research, clinical care, all these things are interrelated, where each partner is actually playing a certain role.
And to bring in efficiency in the way we handle affairs and matters that will improve not only patients' well-being, but more importantly, how we manage these patients in a more effective way with the limited resources that we have.
I think that is why we exist. If it wasn't for the patients, if we're not making an impact on the patients, then why are we really here?
From a person living with NCD perspective, financing is translated in access to services. Financing is translated to me not being forced to sell my piece of land to take myself to hospital.
I think the most important approach to NCDs is the multisectoral action.
Non-communicable diseases affect people. They are not statistics. They are people. We call on all stakeholders to play their part in putting people first and catalyzing change. Together, we can forge a healthy future for Kenya.